As we await that national view, we are also getting new information about provincial responses. Ontario, for example, acknowledging for the first time it's into a sixth wave, and health officials are rolling out a new plan that does not include mandatory masks in most public indoor settings. Michael Serapio is here with the details. Good morning, Michael.
Good morning, Heather, and you're right. No mandatory masking return. And for people who are sick of masking in Ontario, well, it was the news they wanted to hear. For those who are worried about the spike in COVID cases in the province right now, well, it was the opposite. Disappointed that Ontario's top doctor, Kieran Moore, says that there would be no broad mask mandate, at least not yet. Instead, what he suggests is masks continue to be mandatory only on public transit and hospitals and nursing homes. For everyone else, it is strongly recommended for indoor use, but really up to individuals to make a choice. As you said, Ontario is right now in the midst of a sixth wave. The director of the province's science table says Ontario could be seeing upwards of 100,000 new cases a day. Still, Dr. Moore believes voluntary mask use is effective in meeting the challenge, along with, as you suggested, other factors. Take a listen.
We have our 3-point plan. Continue to wear a mask, continue to get vaccinated, ensure that you keep up to date with your boosters, and know if you would be eligible, after discussing it with your healthcare provider, for antivirals. Those three major platforms will help Ontario through this next wave.
So you heard it right there. Continue to wear a mask from Dr. Kieran Moore, although that is voluntary. But it was interesting, Heather, when you were talking to Dr. Isaac Bogosh in the last hour, it was interesting to hear his reaction to all of this, because he says with or without a mandate, given the high spread of the virus right now, it just makes sense to use a mask voluntarily. Take a listen.
Oh, yeah, wear a mask. I mean, we're in the midst of a wave. There's a lot of COVID out there. If you're going into an indoor setting, it's important to put a mask on. Of course, it's not perfect, but it does help. It helps protect you. And of course, if everyone's wearing a mask in an indoor setting, it creates a much safer indoor environment. And at a population level, if everybody's wearing a mask in an indoor setting, it can take the edge off a wave. I think it's a very, very reasonable thing to do.
That said, Ontario's top doctor did say mask mandates could be triggered again if they are needed. For now, it is voluntary use, more PCR testing, more antivirals that are being pushed out into the system for those who qualify. Vaccines, of course, including the boosters, the fourth dose is now being recommended for some, and monitoring, Heather.
Michael, there is a school board in Ottawa that is not satisfied with the voluntary, wants more mandatory. What is it going to be doing tonight?
Well, really, this comes from Trustee Mark Fisher, Heather. He's with the Ottawa Carleton District School Board, the largest in the nation's capital. And a bit of background here. About 20 schools in the district were reporting more than 20% of staff and students absent last week. Schools have also had to close down in recent weeks. And wastewater tracking in the nation's capital, well, that is detecting record amounts of the virus in the wastewater of the city, which is why Fisher wants mandatory masking back in schools. Take a listen.
I think it's the simplest, safest thing that we can do to an enhanced measure that we can put in place to really help the city of Ottawa tackle this extraordinary increase in cases that we're seeing in our sewage. And that's a leading indicator of what we're about to see in our community and potentially our hospitals.
Now, the Ottawa Carleton District School Board trustees will be meeting tonight, so we'll see if this motion is actually debated. That is something that we'll be tracking today. But really, it underlines the tension in Ontario right now. The top doctor again saying that mandatory mandates are not needed at this moment, but many people on the front line saying they want them back, Heather.
Michael, thank you very much.